Hello everyone, this is Assistant Medical Director Dan Summers here with Medical Director Bob Johns for the Crystal Shores EMS. We're here at the Crystal Shores Hospital to show you guys our system that we call ACE. This is our medical system, and this is what EMS will be using to treat patients on various scenes. It is a complex system, however, and this training video should be used as a supplement, not a substitute, for any actual training. So, me and Mr. Johns here will be trying to treat this patient who is clearly deceased already. I will be pushing any drugs or medication, while Bob here will be handling any bandaging and things like that. So the ACE system works by using basically a user interface that you'll be able to pull up using your tablet here that you carry with you in the field. On your tablet, you're going to want to press Control and Windows key, and that'll pull up an interaction menu that scans the patient and allows you to interact with them. Correction, that's just Windows key, not Control and Windows key. As you guys can see, when I hit Windows key, it pulls up the injured area of the patient and the options I can do with them. Bob, if you'd like to start.
Sorry, we gotta start all that over. Sorry, we gotta start all that over. Messaging is we're possibly gonna move downstream, start all that over. Messaging is we're possibly gonna move downstream, start all that over.
Alright. Who's
Sorry about that. Sorry about that, but yeah.
Was Zach Kloff gonna move us?
Yeah. Possibly.
Alright.
Sorry about that. Sorry about that.
Good.
You're on a roll though. You're on a roll though. We can't treat these guys once they're deceased. We can't treat these guys once they're deceased. It's glitching on civilians, so you'll probably have to shoot me. It's glitching on civilians, so you'll probably have to shoot me.
Well, you can still bandage them and stuff. You can still treat them, you just can't actually save them. We got a couple other people, so we'll just roll with this guy first, and then we'll go from there.
Ready. Ready.
Alright, are you ready?
Yeah.
Alright.
Yeah.
3, 2, 1. This is Assistant Medical Director Dan Summers and Medical Director Bob Johns of the Crystal Shores EMS. Today I've got my GoPro here, and we're going to be showing off the Crystal Shores ACE system, which is the system we use for treating patients. All EMS and firefighters in the field that are medical trained will be given a tablet which will allow them to basically scan any patients and see where their injuries are, and we'll show you how to use this system and how it works. So we've got a patient here who's simulating being deceased. As you see, myself and Mr. Johns have weapons. These aren't actual weapons. They're simulation rounds. They fire blanks. However, these test dummies we have here do simulate real wounds as working with the system. So we're going to pull it up using the Windows key on your tablet here. So you can see the patient's bleeding, he's in pain, and he's got a couple of wounds on his torso here. The system will display in red cross on any injured part of the patient's body. So let's take another look at him here. So as you guys can see, his torso is the only injured thing on him. Depending on which part of the patient you're looking at, you guys will be given different options for medical treatments as appropriate by that part of the body. We want to take the patient's baseline here, so we're going to take a look at his head, which is where those readings are taken from. Patient is not responsive, which, not surprising, he's deceased. I'm going to check his blood pressure, which is 0, and his pulse. And he has no heart rate. So this man is officially deceased. Now, in a normal situation, we'd put a body bag on him and leave him for the local coroner to come and pick up and remove from the scene or a potential police investigation. Oh. Alright, so Mr. Johns already did that. So we'll have to move to another patient. Once the patient's in a body bag, deceased or otherwise, you will be unable to move them, as per current laws of Crystal Shores. As you can see, there's no further treatments. You can drag them and move them away from the area, but not much else than that. So we're gonna take one of our other test dummies here, and we're gonna just injure him. We're gonna shoot him in the leg. All right, so I'm going to be handling a drug administration, and I'm going to be taking readings of the pulse and blood pressure here as need be. Johns will be handling a bandaging and things of that nature. So the patient's right leg was injured. And as you can see, our UI shows that he's been bandaged. It's a little bit buggy here depending on your angle. So I'm going to stand up and take his blood pressure and stuff since he's standing. So his blood pressure is 116/77. And his pulse is 72. Now an ideal blood pressure is 120/80 and then a heart rate of 80. So he's a little bit weak, but he just got shot, so that would be expected. Let's take a look at the triage card. Nothing on the triage card right now. We're going to say he is a minor injury. If you look on the left of my screen here, you'll also see that now he's listed as minor injury. He's got no injuries on his torso, but he's in pain from his gunshot wound, and his leg's been bandaged. Looking down below the injury listing, you can see that Bob Johns has bandaged him a few times, and that I have taken his blood pressure and pulse. You can also see, looking at his leg, he's got bandaged velocity wound. Anyways, any wounds that are bandaged have the possibility of reopening if not treated at a hospital with a proper surgical kit. Any injured patients should be taken back to the hospital for full treatment and proper stitching. Patients can be treated in vehicles too, which we'll demonstrate in a little bit here. But first, we're going to give this gentleman something for his pain. Now check his pulse one more time. All drugs that we give have some sort of side effect, and it's important to know how they work. We're going to move over to the patient's left arm here, and we're going to give him morphine. Morphine's arguably the most common drug we're going to prescribe in Crystal Shores. There's a lot of people with injuries, and it's the most common treatment we have for pain. As you guys can see, his heart rate already dropped by 30. That's quite a significant drop, especially after his shot he only dropped by a few points. I'm going to check it one more time again, see if it's seen stable. So it's already to 42. Now, as you guys can see, a patient with a low heart rate could potentially be killed by administering morphine without properly watching vitals such as heart rate and blood pressure. And it's worth noting that those two do coincide, and that low blood pressure can also affect the heart rate and vice versa. So both should be taken into consideration generally when treating a patient. We'll now give the patient epinephrine. This will increase their heart rate and will avoid any injury. This isn't always necessary. Certain patients are less likely to see a drop in heart rate that much. And since this is a dummy, I'm sorry guys, I can't talk here, but since this dummy obviously cannot move, he can't raise his heart rate. A normal patient who can run around or have some sort of activity will be able to increase their heart rate through strenuous activities such as jogging or combat, although this is or ill-advised for an injured patient. As you guys can see, our patient's wound has reopened. Mr. Johns is already bandaging it. Now, in a normal situation here, where I wouldn't be talking to you guys, Bob Johns would communicate every time he bandages the patient, and I would communicate every time I've pushed drugs on a patient. So, that being said, let's get this guy in our makeshift ambulance here, which has been borrowed from the local military base. Well, our ambulances are currently out being worked on and going through some basic repairs. So we've got a HEMT here, and we're going to load our patient into the HEMT. Director Johns is going to pull that up for us, and we'll display how treating a patient in the vehicle works. Okay, so obviously with a patient, you can't pick them up and force them into a vehicle. A conscious patient, I should say, is able to deny treatment if they wish. However, you must make them sign a waiver in order to release them without taking them to the hospital. Normally, you'd pick up a patient by going through the interactions menu, but since this gentleman's currently conscious, we're going to have to change that. Alright, perfect. So, our patient's now unconscious but still alive. Taking... Oh. Dipped back into consciousness there for a second. So, Bob Johns has placed him in the vehicle. I'm gonna get in the back seat here. The patient's in the front. Normally he'd be in the back of the ambulance with us, but I'm going to use my very long reach to treat the patient from here. Now, as you guys can see, there's a lot of split menus on the radial menus that we use to treat a patient from a vehicle. Certain treatments can still be administered, but it makes it more difficult to treat certain wounds with such a branching system. That being said, a patient should generally be stabilized prior to transport. But this is a good way to be able to save a patient who, say, starts bleeding again in the process of transport without needing to stop and potentially risk further harm to the patient while waiting to go to the hospital.
You want to unload him?
Yeah, the patient's been unloaded. He was conscious again for a second there. He tried running away. You can drag or carry a patient. However, you do need something in your hands, such as our fake pistols or fire extinguisher. Not having these items can lead to you basically getting into a locked position, which you won't be able to get out from without the leverage. In order to release the patient, you have to scroll up on your tablet here using the wheel on it in order to get the option to release the patient. This will allow you to move unconscious patients closer to vehicles or away from harm if need be. Alright, so our patient's lost a lot of blood. Mr. Johns, could you please bandage this patient's left leg while I administer saline? As you guys can see, I have a few different options for saline. So, how much do I need to administer?
I would start off with plasma.
It says the patient's lost a lot of blood, but generally plasma and blood need to be refrigerated. The system is aware of this, and after 15 minutes without refrigeration, they can go bad. Patients lost a decent amount of blood here, so we're going to push 1,000. Saline's basically just salt water. and it's generally used for cleaning out the system or helping to rehydrate a person. However, for the purpose of ACE, this should also increase their blood pressure. I'm going to give them 1,000 milliliters of a saline IV here. That's a good bit here. But we're only going to give them one, and we're going to monitor them. This can take a little bit to take effect sometimes. As you guys have seen throughout this video, you may need to move to in order to properly check a patient's vitals or treat them, depending on where you're looking. So our patients regained consciousness, and he fell back down almost immediately. But as you guys can see, he's right on the verge of regaining consciousness. His blood pressure is slowly starting to go back up now that the saline's been administered.
I'll give him morphine.
Well, I
don't have any.
I'll administer the patient's morphine here since as I stated earlier, I was going to push the drugs. We'll also need to push epinephrine on him pretty quickly in order to counteract the effects on his heart rate here. Alright, administering morphine. Alright, and the dummy is trying to reset here and get back to his original position. So we're going to follow him, provided he doesn't die due to a drop in his pulse. Alright, we're going to give him another dose of epinephrine. A patient who's experiencing severe blood loss from one of their limbs, you can help them by placing a tourniquet on said limb.
Should I give him 250 blood?
Yeah, go ahead and push blood here. Whenever somebody's going to push something, you should just check the blood pressure and pulse. His blood pressure is still low. Like I said, it does take a little while for saline blood to take effect, so try not to push it very often unless the patient's severely low and there is concern that they'll die without pushing multiple. And even in those cases, take caution when doing such. So we're going to apply tourniquets to the patient's right arm here. Tourniquet works by basically cutting off blood flow to that arm, which in turn will slow blood flow throughout the entire body. This isn't important just because it can slow bleeding from massive wounds, but also because it can stop blood or drugs from circulating throughout the body properly. If you have a patient that's in pain and you administer morphine to their arm, the tourniquet will stop the morphine from taking full effect. If our patient was still in pain, I could properly display this. However, if you have a patient you've administered morphine and they're still in pain, check to make sure that there isn't a tourniquet that's been placed on the patient previously. So our triage card now has information on it. It shows that he's been injected with morphine twice, as well as epinephrine twice. He's been given 1,000 milliliter of saline and one tourniquet. It also shows that Bob Johnson has given him an IV in our lower one. However, it's not actually shown that he is applied that inside the triage card. However, when looking at the patient's injuries list, it can show you he's receiving an IV and how many milliliters is left inside that IV before that's empty, which is very useful information. The previous iteration that we called CSE of this, which this is based off of, didn't show us this information. I'm going to check our patient's blood pressure again, see how he's doing. So he's up to 106/70, starting to look a lot better. He's obviously conscious for a while now. With that being said, he's not out of the woods. He can still show a drop in blood pressure. He can still show a drop in heart rate, both of which, like I said, affect each other. His heart rate's actually a bit high now due to that epinephrine. Clearly, the morphine didn't have quite a big effect, which is why it's important to check for pulse and blood pressure before administering any drugs. In this situation here, however, with the patient stable, bandaged, we would get him into the truck and drive him to the hospital. We're going to take his tourniquet off. Having a tourniquet on for long periods of time can potentially harm a patient. So make sure to remove any tourniquets or anything from the body once they're no longer necessary. Now, being that he's once again conscious, we can no longer load him into the vehicle. Any conscious patients do have to go of their own will. With that being said, there's other equipment that you'll need to know as a EMS. So we're going to go over to our medical boxes here, and we're going to take a look at some of that. So as you guys can see, there's a full list of the equipment that I've used here, as well as some other stuff. The basic bandage is what any civilian can use. These aren't quite as effective as some of the other bandages that you might use. Further down we have the packing bandage, which is used to cover medium and large wounds. These do quite a bit more healing and last longer than basic bandage. And where basic bandage might take 2 or 3 bandages to cover up a wound, these will only take 1, maybe 2, depending on how severe the wound is. These packing bandages would go inside of a wound, and then you would use an elastic bandage to cover that up. Our tourniquet, which we displayed, morphine, atropine. These are used in situation of like a biological, chemical type of thing. These can also be used to basically trick a patient into thinking they haven't taken morphine or epinephrine. However, they can overdose on this, so be careful when using it. Plasma, saline, and blood. Like I said, all these can basically restore a patient's blood. However, plasma and blood need to be refrigerated. As I said, they can only be outside of a refrigerated area for about 15 minutes. Certain ambulances do come stocked with a refrigerator. It just depends on where you are. Basic field dressing. This is basically a combination of a packing bandage and an elastic bandage. However, it's not quite as efficient. A personal aid kit and a surgical kit. These can allow advanced treatment. However, these are generally used only at the hospital to fully heal a patient if need be. Once the patient is at the hospital, a licensed doctor or the highest acting medical officer on scene will use this to treat a patient.
Our patient's still in pain. Our patient's still in pain.
That's show. Oh,
We get perfect. No. We get perfect. No.
he's over here.
Oh. Oh.
So this is unusual. Our patient is still in pain right now, given that he has been given a few doses of morphine at this point. The pain isn't an immediate threat to a person. It can cause unconsciousness if severe enough. However, in most cases, pain can be ignored if morphine doesn't take effect. With 2 doses of morphine already, a third is inadvisable. At this point, the patient should just be treated at the hospital for his pain with a more permanent solution. Guys, this pretty much wraps up the basic training of ACE. As I said at the start of this video, this shouldn't be treated as a substitute for actual training, which will be required by the Crystal Shores EMS and Fire Department. However, this video can be used as a supplement to it in order to aid further training or to reiterate past training for long-time members. Any questions in regards to the ACE system should be directed to one of the medical directors or one of our FTOs. Alright, thank you guys for tuning in, and hope you look forward to future training videos.